Now, let's have a guest now join us from our Abuja studio, a public health specialist, Dr. Isaac Egboja. Dr. Isaac Egboja, it's nice to have you join us right now. From the reports we've played, and even others that we couldn't have the time to play right now, shows how countries on the African continent are taking drastic measures. We haven't seen that kind of measure from Nigeria. Are we too confident that this may not, there's nothing to worry about, or we're still expecting Nigeria to take a drastic measure?
Well, every country takes steps and measures depending on their situation. Even within a particular country, the measures they take, the steps they take, depend on the situation from day to day. As far as Nigeria is concerned, the health authorities have so far demonstrated that they are capable, they know what they are doing, and they know where we are going. The fact that they are able to dictate and identify 2 cases and handle them very well is a reason for us to have confidence that they are capable and they know what they are doing. Right now, there are two fronts. The first front is the airports or the ports of entry, where people that travel to other countries or are coming to Nigeria are entering through. And we have been told over and over that there are health authorities stationed there who are watching, who are testing, who are observing and following cases if and when they come. The second area is internally. Every state right now has gone out to tell citizens that they should be careful, they should wash their hands. If they have any symptoms that resemble those of coronavirus, they should report. And states are gearing up. The federal government has been doing very well. The Center for Disease Control is in charge. And we don't have any reason to doubt the Nigerian authorities that they are capable of knowing when to give certain instructions. I believe very strongly that if the need arises for Nigeria to go to such level, the health authorities will alert us. So far, there isn't a need for that. They feel confident that they are in control, and we shouldn't have any reason to doubt them. I wouldn't say that they are overconfident. When you are in a situation like this, you should imagine that you are in a car or in a plane. And if you are in a car or in a plane, as a passenger, you should have confidence that the driver or the pilot knows what to do, how to do it, and when to do it, and that he or she knows where he is supposed to go. If you are also the pilot or the driver, it is for you to exercise patience too, and also confidence in yourself, and check yourself, rehearse your skills, and make sure that you are ready for any eventuality. The health authorities are doing exactly what they are supposed to be doing, in my own opinion, and we should trust them. We should believe what they are saying, and if there is a need for us to observe those conditions that other countries are observing, the health authorities will let us know. But for now, each country should do and give instruction based on their peculiar situation. This is our own situation in Nigeria.
All right. Thank you, Dr. Isaac Egboja. We have to leave it here for now. Dr. Isaac Egboja is a public health specialist. Thank you so much. All right, joining me now from Abuja studio is a public health specialist, Dr. Isaac Egboja. It's nice to have you join me right this morning. Now, there were fears initially that when coronavirus gets into the African continent, it was going to wreak a great devastating havoc because of the weak health system. one way or the other, especially taking a cue from Nigeria, it seemed to be the other way around. Nigeria and African countries handling the issues well, to the level where Michael Ryan, the executive director of WHO Health Emergency Program, in a conference in Geneva, used Nigeria as a reference point for something that they are doing well in which the world have to emulate. You are in that space right now. What is Nigeria really doing well in containing the virus which other countries have to emulate?
Well, we are all aware of the fact that so far we've had only 2 cases in Nigeria. When the first case was reported, the Nigerian health authorities handled it very well, very efficiently and effectively. When the second one was also detected, it was similarly very well handled. The preparation, the execution of the plans, and the way the authorities have been going about containing this pandemic is exemplary. And we should only thank God that they are doing well, and we need to cooperate with them. And this should also send a signal to all of us and a message to all of us. There are many Nigerians who don't believe in anything Nigeria, who don't believe that the health authorities in Nigeria can do anything good. Even for regular medical checkup, they would go abroad, they would go to Europe, go to America, go to some other place, whereas those things could be done in the country. If anything, I think we are learning from the fact that Nigerians are capable of handling situations, especially when they are given proper attention. The health authorities are demonstrating so far that when they are given the right support, the right environment, they can rise to the occasion. We need to do well, especially for the fact that we're the African, we're the largest country in Africa. We're supposed to be the leader of the African continent, not only politically, but also in other spheres of human endeavor. For us to do well, we need to prepare well. And for us to prepare well, we need to be properly equipped. When I talk of equipment here, I mean to be equipped with health infrastructure, to be equipped with health equipment, and to be, above all, to be equipped with health knowledge. We need to train new staff, health staff. We need to retrain those that are already trained. And all these things cost money. But more importantly, we need commitment. Commitment from individuals, commitment from organizations, commitment from government. When I say government, I mean local government, state government, federal government. The commitment we are talking about here is not just verbal commitment, serious commitment. We could see now that when the federal level in particular gave support, gave money to the health authorities, they have executed what they are supposed to do, and they are doing it very well.
All right.
And we're having the results that we're having now.
All right, Dr. Egboja.
Yeah.
Due to time, let me ask you this. Some African countries, Ghana, South Africa, Rwanda, and the others, are initiating outright ban of people traveling from certain countries. Would you advise Nigeria to toe that line?
I wouldn't say so now. Like I said earlier, every country is reacting or acting depending on their peculiar situation. That is not our own situation at the moment, and we should wait until the Nigerian health authorities tell us what to do. So far, so good. The way it is going, if we are lucky and we continue to be vigilant and diligent the way we are, we might not need that type of stringent measure. The great Napoleon used to say that God marches on the side of the stronger battalion. So far, we are proving to be a stronger battalion, and it is my prayer that God will march on our side.
Well, that's a prayer of every Nigerian one way or the other. Now, the last question I'm going to ask you centers around the issue of vaccine. Now, so many countries are looking out for this, and from the reports we hear that the United States is on the verge of testing one of the vaccine on people for the first time. How close or far are we to getting final solutions to this, at least from what you have heard from maybe your colleagues at WHO?
Well, it is good that, and heartwarming that efforts are being made to develop vaccines, but those vaccines are not going to be ready overnight. And even when they are developed, with the pandemic that we have now, the number of people that we need the vaccine, it will take quite a while. This brings me to a point that I would like to raise here. We as a country need to look inwards and try to develop our own capacity in many ways, in the pharmaceutical industry, in producing our vaccines, in producing our drugs. This particular pandemic should teach us a lot of lessons. And one of the lessons is that we should be ready, we should be self-reliant, we should be doing our own thing, our own way by ourselves, and not waiting for others to do for us.
All right. All right. Thank you very much, Dr. Isaac Egboja, public health specialist.